One of the other important things to discuss for LGBTQ plus individuals is fertility preservation. So, fertility preservation can entail either sperm freezing or egg freezing. Oftentimes, this can happen at a variety of times in a person's journey during gender affirmation. So, starting with transgender females or non-binary persons who are starting estrogen therapy and testosterone blockers, ideally we can meet a reproductive specialist before starting that journey and talk about the utility of freezing sperm at that time. We do know that there is some risk to fertility with these medications, and ongoing data will help guide further instruction for these things. But for now, just knowing that there's any risk, oftentimes I'll talk with patients about trying to bank sperm prior to starting this journey. It's not an option for everyone, but banking sperm to then later be used for things like IUI or in vitro fertilization is a really important part of the initial counseling when talking about gender affirming care. So sometimes we're helping provide guidance about temporarily stopping estrogen and testosterone blockers and doing analyses so that patients can understand if they're having a return of fertility or if it's important to bank at another time in their journey. Potentially this can happen before gender affirming surgery as well. For our transgender male or non-binary patients, again, ideally we're meeting these people before they're starting their hormone therapy with testosterone so we can fully talk about the utility of egg banking at the start, but that's not always an option for everyone. So sometimes we can meet patients and talk about temporarily stopping testosterone therapy and egg banking at another point in life, or potentially even seeing if patients can have sperm exposure and conceive on their own off of testosterone. Again, this is a very individual decision. Some patients don't feel comfortable stopping medications or carrying a pregnancy. So this discussion is really important to have and very variable from patient to patient. But fertility preservation is an integral part of providing good care for our transgender and non-binary patients.